welcome to Health Issues 2010. I'm your host, Chris Sylvain, and believe me, I could not be more excited about this show today. It means so much to me. Believe me, we have the new, freshly appointed Dean of the Xavier University College of Pharmacy. We have Dr. Kathleen Kennedy here with us today. Thank you so much, Dr. Kennedy.
Well, thanks for inviting me.
Well, I am excited. We are excited. We really are. And before we even get started to talk about that, tell us a little bit about Dr. Kennedy. You've been at Xavier, but you worked in industry. You've been, solid career.
Right. I came to New Orleans in 1979, and worked at Xavier as an assistant professor. Yeah. After that, I worked at Charity Hospital. I was the director of pharmaceutical services at Charity Hospital, actually while I was still at Xavier, so I had a dual appointment. And after I left Xavier and Charity Hospital, I went to work for Bristol Myers Squibb, so I was in industry. Right. And came back to academia, my first love, in 2002 as an associate dean.
Yeah, but you've had other training with Harvard and so forth.
Right, I did a management development program at Harvard in the graduate school there, and I completed a leadership fellowship with the American Association of Colleges of Pharmacy.
Good, and California.
Yeah, well, I got my degree in the University of California, San Francisco, and did a residency there.
Amazing. I've always been excited, had the opportunity to watch much of the career to really see that. One of the few African-American female deans of colleges of pharmacy. I think you're number 2.
No, there are actually 5 of us now.
It's 5. Okay.
Yes.
All right. Awesome. Well,
out of 120 colleges of pharmacy.
That is the key, and that's to every young female, male, whatever, to see, hey, work hard, huh?
Right. I think you have to have a good foundation first. You have to, make sure that you're grounded in academics, and then you develop the skills. You have mentors who will help train you as you move up in the, in the pharmacy arena to get more management skills. So it's good though to have a good foundation.
That's good. Tell me about the management training though. How important do you think that it is or was?
Well, it really is important. Actually, the pharmacy organization, the American Association of Colleges of Pharmacy, is really looking to train future deans because they recognize that the deans that they have are graying and will be retiring. So they have a program to help train future leaders in academia, in the colleges of pharmacy. And before that, I did that Harvard management development program, and that was really very intense. A very good program, and when I completed that, someone who also had completed that suggested that I do the program with the colleges of pharmacy. So yeah. I think it really gave me a good foundation for management, leadership skills, finances, things like that.
The job of a dean. Tell me about this job of a dean.
Well, the dean really sets the vision for the college. Okay. The management you have in the college, we have chairs who really do a lot of the managing, but really it's to set the vision and to look forward to see what is in the future as far as pharmacy practice and to help guide us in that direction. So to look at the curriculum to see if there are changes that need to be made to make sure that our graduates are prepared for the changes that we foresee.
Interesting, because the graduates are just coming to school and they can't really see that far. They hadn't even graduated yet, but you literally have to see way ahead to see what's going on.
Right. You have to really keep abreast of what the industry, where the industry is going, and what's being talked about for the future. And sometimes the students don't understand that, and they question why they have to take this course or that course, and they don't recognize that at the end, it'll all come together. And even after you graduate, you have to continue. You have to be a lifelong learner so that you are prepared for the changes that occur. So we want to make sure that our students, again, are grounded in the basics so that they can change with the changing environment.
And pharmacy is changing right now, whole new field.
Right, especially with healthcare reform, some of the opportunities that are out there for pharmacists in medication therapy management as an example, where pharmacists will take more of a leadership role, working with teams, interdisciplinary teams to address patient care.
Yeah, and it seems as though things are finally happening, because I remember, 20, 30 years ago when, it was piddling around the College of Pharmacy, they were speaking about pharmacists and their new expanded roles, and that technology would wipe everything away. And in 30 years, things don't really look any different. But it seems as though now we're at the cusp of a whole new revolution in taking care of patients.
Right. Pharmacy, actually, we have been evolving, because some of the things that we're talking about now, they were doing years ago in California, where I trained, and in some of the other, states like Florida and New York.
Yeah.
But now it has expanded so that everyone is exposed to the opportunities that pharmacists have, and the help, that they can provide working as part of the team. We don't want to take over patient care. We want to be recognized as an integral part of, that whole healthcare team.
Now, interesting. Now, let's touch upon that. Health reform. Not too many dollars out there.
Right.
How does pharmacy grab their part?
Well, this whole idea of medication therapy management is where we really fit. I mean, the pharmacists are the drug experts, so they can help in the whole scheme of healthcare reform to reduce costs by making sure that patients are on the appropriate drugs, that there are no adverse effects, that patients are adhering to their medication regimens. They can help with educating patients so that they can change their behavior to improve health outcomes. It's all about improving health outcomes, and the pharmacist may not get a piece of the money, but in this country we want to reduce healthcare costs because we all benefit from that. And so, as an integral part of the team, that's the role that I see pharmacists playing.
Interesting. Now, Xavier's HBCU. It literally is, and graduated probably tons of pharmacists out in the community, or particularly in New Orleans. I mean, the reputation of Xavier producing these educated professionals that's saturated throughout the city of New Orleans. I've always felt that had a major effect on the culture of the city. What do you think about that?
Well, I think that you can go in just about any community pharmacy and see Xavier graduates. So they are practicing here, and we hope that their training will eventually change the way that pharmacy is practiced in some of these community pharmacies in the chains. We're talking about spending more time educating patients. So we hope that at some point they will get the time to spend with the patients, to talk to them about their medications, to find out if they're having any problems. So that patient interaction is very important. We see that some of the stores, the chains, are actually putting in these clinics where there will be an opportunity for pharmacists to interact more directly with patients.
Now, interesting. Now some on the industry side, the chain side, say the rate limiting step is the pharmacist and not the chain itself, and that the pharmacist, waiting for the pharmacist to come out excited and energetic and so forth. I don't know a lot of pharmacists agree with that.
Right.
What do you think?
Well, yeah, that really is what we hope will happen. I think that's what our accrediting agencies have been saying for a long time, that we need the colleges of pharmacy across the country to sort of drive the practice of pharmacy, so that students who are graduating, who are well prepared for these roles, will go into some of these chains and say, I want to do something other than just dispense. Someone was telling me just the other day about a store in Florida where that is in fact happening, where someone else is doing the preparation of the medications, not the dispensing.
Right.
And the pharmacist is spending all of his time counseling the patient. So, that's a perfect example of what we hope will happen. You definitely need someone to dispense, so we have the technicians who are licensed.
Okay.
They can prepare the medicines, the pharmacist can check them,
Right.
but spend some time talking to the patients, about how they're feeling, how this is working,
Okay.
looking at potential drug interactions, adverse
Right.
effects, things like that.
Now, interesting thing now, there's your thoughts on it, that pharmacists move away from checking. Because many people say that within the operation, as long as the pharmacist has to check to make sure it's the right drug, they're kind of locked into that. But once you release them and allow the technician to check, then the pharmacist can spend all of their time just really talking with the patient. Would you ever feel that that's something that could be considered, where the technician, hey, they can match a 3125 pill with a picture of it?
Well, I hadn't really given that much thought, but with the technology that's coming down, barcoding, that kind of thing,
Right.
it's something that really could be considered, that the pharmacist could move away from that to spend more time counseling patients.
Interesting. Now let's switch over to health disparities, because that's the area that I know you've spent. You were the director. If you can tell us a little bit about that particular program dealing with health disparities, how do you see pharmacists' role in affecting health disparities?
Well, the health disparities, as we know, account for a large amount of the healthcare dollars that are expended in this country, because most of the major diseases that disproportionately affect ethnic and racial minorities are costing a lot of money because of the morbidity that's associated. Patients, for example, who are diabetic, who are not well controlled, who end up back in the hospital.
Right.
Patients who have cancer, who are not diagnosed early, that cost a lot of money to take care of those patients.
Yeah.
So there is a need for someone to focus on these disparities. And it's not something that one individual healthcare provider can do. Again, it takes a team of people to work on this, the physicians, the pharmacists, the nurses, etc.
Yeah.
So everyone really needs to work together.
Okay.
One of the areas that we focus on in the College of Pharmacy is cultural competence.
Wow.
In particular, training people to recognize the diversity that we have in this country and to be able to relate to people where they are, so that you can talk to them and understand what their culture is, and possibly talk to them more about adhering to their medication, because you know a little bit about where they are. You're respecting their beliefs, but also trying to suggest the best for them to improve outcomes. So that's one area. But the whole idea of the medical home model that has been that's included in the healthcare reform,
Right.
where again you have this team of people working together, and that's where pharmacists can play a role as well,
Wow.
working to assist the physician who's probably leading the team to help educate the patients about their drugs, to help change behavior. There are a lot of models of what pharmacists can do and the impact that pharmacists have made as part of an interdisciplinary team to improve health outcomes.
That is so unbelievable, because when we think about health disparities, the first thing that comes to mind is not, I would say, the young, able-bodied, middle class. We think about those that were once, that went to school during segregation. Right now, they could be in their 70s or their 80s, and they account for the diabetes and hypertension and so forth. And who's going to help them? And when you think about cultural competence,
Right. I mean, you have to think about, the culture, and because you can say something to someone who has Hispanic background, and they don't understand what you're saying. If you don't understand the culture, where they're, how they've been trained, and so many different things that your mother may have told you that you must do.
Right.
And if I, as a healthcare provider, dismiss that for you, then you have no confidence in me. me? You know, what do you mean questioning what my mother has told me all these years that I should do to take care of this problem?
Right.
So you have to be open and accept what people believe, but you also then have to try to convince them to maybe negotiate with them so that they can do what you need for them to do, as well as, you know, what their mother said. My mother, for example, believes that chicken soup cures all, you know, colds. So if she calls me and I'm not taking my chicken soup, it doesn't matter if I need antibiotics or I need cold, you know, cough syrup. It's that chicken soup that I'm not taking, and that's why I'm not getting better. So, you know, and so if I go to you and you say, oh, you know, this chicken soup doesn't mean anything, then I'm going to think, well, what does he mean telling me that my mother didn't know what she was talking about? So it's that kind of thing. I mean, that's a simple example, but you have that from different cultures, you know, and there's such a diversity here in this country. We have to recognize that people have different beliefs.
Now let's look at it this way. It's been said that if we would not look at ethnic minorities and include them in the rankings, the United States would be way up there. So if we ever address health disparities, then that would literally solve the healthcare issue for America.
Well, first of all, health disparities, you know, that means that you have diseases that disproportionately affect different groups of people.
Right.
So that if you didn't have, you know, these groups, I guess you would not have disparities. So, you know, I don't know how to address that otherwise.
Well, no, but all right. But the thing of it is that it's like looking at the work that Xavier, that you know, and you spent a large part of your career looking at, becomes almost the key area that really other people need to start looking at. If we can address these health disparities, you know, you're looking at health reform and everything else like that, but maybe we need to start looking at communication. We need to start looking at what are those factors that's
well, communication is, you know, a big part of that, but as I said, there are a lot of people here in the city who are working on health disparities in the College of Pharmacy, because, you know, we believe that as part of our mission that the pharmacists that graduate should have a sensitivity for the disparities that exist and be able to communicate better with people to help eliminate. That's just one aspect. You know, there's so many social determinants of health that, you know, affect people and cause the disparities. Access to health care. So there are a number of things. But as far as the research that we're doing in the College of Pharmacy, we have the basic science research that's focusing on cancer in particular. We have the health disparities in the clinical division that's more behavioral based, you know, developing models of care that you can say, you know, this works, and so if you do this for a group of patients, it will improve their health outcomes. So that's how we're addressing health disparities. But, you know, we're partnered with LSU and Tulane in a lot of the work that we're doing to address health disparities.
But tell us a little bit about that, because that's pretty new. That's the exciting area, the health disparities and dealing with cancer itself. It's like one particular disease and dealing with health disparities along with it. Right.
Well, you know, Xavier is part of the Louisiana Health, the Cancer Consortium, and we're a partner with LSU and Tulane and Ochsner to focus on cancer. And in the college, we have several people working on breast cancer. You know, prostate cancer is another area. You know, estrogens and different things that may cause cancer, and how people who are affected by cancer, in particular African Americans, you know, how that presents. So those are some of the areas that we're looking at in the College of Pharmacy.
Oh, that is so awesome, kind of cutting edge, looking at what's going on. Nanomedicine. Tell us what
basically, you know, when you think about, well, let's take cancer as an example, you know that most of the drugs that we use are toxic to all the cells in the body. And so if you could develop a delivery system that would put that drug right at the, you know, the area that you're trying to address, say the tumor, then that would be a wonderful discovery and something that would be very effective for the patients to decrease the morbidity that's associated with, the treatment for cancer. So that's another area that's being looked at also.
Wherever we go, people always say that Xavier College of Pharmacy is the best in the nation. It's the best literally, has that reputation, but just recently was ranked as far as for receiving research grants.
Right. The American Association of Colleges of Pharmacy ranks the colleges based on their funding from the National Institutes of Health.
Okay.
And in 2009, we were ranked 20th out of 120 colleges of pharmacy, and that's a jump from 58th in the previous year. So we are really excited about that designation.
All right, where's the future research? What are you thinking about going forward?
Well, I think we'll continue that, especially in the area of health disparities. We've expanded. Originally, we were looking at diabetes. Now we're focusing on asthma. We've always had a focus on HIV/AIDS because we are a national minority AIDS education training center under Howard, working with Howard University and other institutions across the country. So I think we'll be expanding some of the work that we're doing there. We're looking at, bringing people in who have more of a focus on behavioral health while we continue in the basic science research that's going on. We have a lot of good work that's going on there as well. And the good thing about Xavier, we have the College of Arts and Sciences, in particular chemistry department working alongside, pharmacy in this basic science research. We have sociology people there who are interested in health disparities research. So it's really a campus-wide approach to eliminating health disparities.
Teamwork.
Yes.
Awesome. It's unbelievable, really, when you think about that. Medicine is kind of been static or whatever in nursing and everything else like that. But many are saying that pharmacy is the next field that just kind of totally transform healthcare with this educated professional out in the communities all over. What are your thoughts there?
Well, I think, people need to recognize that pharmacists are well-trained health professionals and can be an added benefit, as I said before, to that team. Okay. There's the pharmacy students get an excellent background in, just medicine, in chemistry, so that they can approach all of these topics. I think that they are very well trained to go out and to make an impact overall. So.
And most people see their pharmacists at least 4 or 5 times a month.
Exactly. So they could really talk to them about a lot of their problems and possibly get some answers there.
Well, they talk about the saints.
Well, yeah.
But they can be talking about a whole lot more.
Right, exactly.
Okay. What areas, Xavier, again, number one. What areas would you like to see Xavier move to number 1 in now? As you've taken the realm of this, the reins of the ship, what do you?
Right.
What areas?
Well, I guess I think it's important that we continue in the area of research because I think that informs the education. Okay. You have to have the research background for the faculty to be able to, be effective in continuing with their teaching for the students. That's in basic science as well as behavioral. Okay. Those examples are very important when they're communicating with the students. But what I would like to see as far as number 1 is, that whole approach where the pharmacist is part of that interdisciplinary team, okay. That we can say that the Xavier pharmacy graduates made an impact, in particular in this community in Louisiana, in New Orleans and Louisiana, to improve health outcomes. We want to improve the outcomes of patients so that the whole population has better health.
And I think Xavier being the school that it is, and New Orleans being the city that it is, it's a great combination. New Orleans is way at the bottom, and Xavier has a lot of resources to put those together.
Right.
There's a lot of work to be done.
Right. especially in the community. You know, we need to do research in the community. We need to engage the community so that they feel that they are part of this, and so they can, you know, take an active role in improving their health as well.
Yeah, but I mean, everybody sees Xavier as a great diabetes health fair that you guys have out at Lakeside Mall yearly, and students getting out in the community.
And we have the Diabetes Center that's located on Jefferson Highway next to the Walmart there, where people can go in to get glucose testing, their cholesterol testing, education about, you know, healthy eating. So you know, that's a resource that's basically free to individuals who come out to that center. Wow!
So right there on Jefferson Highway.
Right.
They can get glucose testing, and the pharmacist is there for them.
Exactly.
Awesome, awesome, awesome. Well, when I think back at pharmacy and to see the pharmacists that out, I always think about Mr. Bynum. Years ago at Bynum's Drugs, you know, and so forth. And the way he practiced, it was just a regular at-home type of guy. But people they knew to go to him right there and right across from the St. Bernard Project in that area. Seems like we're going back there. Right.
Well, that's really what attracted me to New Orleans. One of the faculty members from Xavier came out to California to the school and talked about some of the work that was being done here, in particular in hypertension, and talked about these community pharmacies and, you know, what they were doing there to educate people about hypertension. So that was really one of the reasons that I was interested in coming to New Orleans and to Xavier.
Hey, we have been excited and appreciative that you found your way to New Orleans. Dr. Kennedy, let's do this. Just a minute. Hey, take your time. Let's go right to that camera. Just a message for the people that you'd like to share, you know, about just the great things. Your call.
Well, I guess I'll just say that I'm really excited about this opportunity. I think that you know, the future is bright for pharmacists and our role as being a member of the healthcare team. And I want to make sure that our students are well prepared for the future. We have you know, such a dynamic healthcare environment right now, and the opportunity is there for us to make an impact, to help improve the health of the community for those people out there, and that's really what I want to see the pharmacist doing. So I'm excited about this opportunity to lead the next generation of pharmacists here at Xavier.
Hey, and we're excited about you taking the realm and to see the great work and the great work that you've already done. You know, people don't realize that the world can change real easy.
Right.
Some dedicated people willing to take some risk and make it happen.
Exactly.
Hey, I'm your host, Chris Sylvain with Health Issues 2010. We're excited about having Dr. Kennedy on. Check us out on the web, healthissues2010.org. You can watch this program, all of the others, but believe me, do all you can, work as hard as you can, fight as hard as you can, and make it happen. Thank you so much.